Welcome to this edition of Let's Be Blunt with Montel. And we happen to be coming to you today from Florida, Miami, Florida, as a matter of fact. And we're talking to the director of the Florida Division of Emergency Management, Mr. Jared Moskowitz. And before taking over as the director of FDEM, Mr. Moskowitz was a state legislator, and before that, a member of the city council in Parkland. He's also in charge of executing Florida's COVID-19 response. And I'm so proud to have him on our Let's Be Blunt podcast today. Jared, thanks so much for being here, sir.
Montel, thank you for the opportunity. Appreciate it.
Absolutely. I know you have been working. Are you coming to me right now from the command center?
Yeah, so we're in the command center. You can see, obviously, the floor of the EOC behind me.
Absolutely. Let's talk a little bit about it, because I think a lot of people want to know, especially Florida is one of the largest states, and, you're hearing mixed messages about whether or not we're still on the slope going up, slope going down, in the middle. Where are we at right now, sir?
Sure. No, that's a great question. And here in the state of Florida, right, we're used to having to deal with spaghetti models, and one model takes the storm into the Atlantic, one takes it over Florida, one takes it into the Gulf of Mexico. So we're used to that. We're also used to models changing on us. We go to bed and we think it's one thing. We wake up and it's a completely different deal. And so we obviously are following the IHME model here. That's the Washington University model that the White House has also have been using. And so, there's been some changes in that model over the last couple of days. Just 4 days ago, that model said we would peak on May 4th. And then just like I said, we went to bed, we woke up the next morning, and all of a sudden the model said that we would peak on April 21st. Dr. Fauci explains that as new data comes in and they put it in the model changes based on the data. It has to do with the model just being a projection. And so right now we seem to be leveling. We seem to be seeing that curve, but we are not yet at our peak. Our peak is still projected to be April 21st. So next week will be worse than this week. And so as we get to April 21st, we then will plateau for a period of time. And then, of course, obviously the devastating news is that deaths will lag hospitalizations. And so even after we peak on April 21st, we should see an increase in deaths around the state of Florida. It's something that's going to be extremely hard. We're watching, obviously, New York, New Jersey go through that. And while our numbers will not be anywhere comparable to theirs, it's still going to be devastating nonetheless to communities around the state.
And what are we looking at as a number right now? What are we calling the number for the total number of cases that have been identified so far in the state of Florida?
Sure. So I think we're approaching about 16,000 cases right now in the state of Florida. And so we seem to be on a steady stream, obviously, of adding about the same amount of cases every single solitary day. South Florida, Dade County, Broward County, Palm Beach County, those three counties are 60% of the cases around the state. After that, you're talking about Orange County, Hillsborough County, or our two other large counties with cases, but nowhere near what we're seeing in South Florida, with Miami-Dade far alone being the county with the most amount of cases and the highest positivity rate. We're seeing, obviously, the folks that we test, that the positivity rate of those folks in Miami-Dade is higher than other places. And that positivity rate is slightly increasing in Miami-Dade, where in other counties we're seeing it level off. And that's not specific to Miami-Dade. That's exactly what we're seeing, obviously, in New York City, in Detroit, in New Orleans, in Chicago, in our major cities around the country. It just has to do with, density and transportation and multi-generational families living under one roof. And so, these are the things that, are happening in Miami-Dade. The mayor's done a great job down there. We have, obviously, all the social distancing, safer at home orders in place. And we're seeing that those mitigation measures are working. But obviously, we need people to still be vigilant. We don't want people to get a false sense of security just because we say we see things leveling off and that we feel good about our hospital capacity. Not just in Dade County, but around the state. We feel good about our ventilator capacity. We feel good based on what the models are saying we're going to need and what we actually have. Right now, in Dade County, about 50% of our hospital beds are empty. And that's a good thing. That shows you that decompressing all these hospitals, like we know how to do in the state of Florida because of hurricanes, and we know how to do them quickly. These hospitals did a great job getting those elective surgeries out and decompressing. And so we really only saw a net gain of a couple of dozen hospitalizations in Dade County from yesterday to today. So, we continue to watch that. Again, as Dr. Fauci said, as new data comes in, the models can change. So we're watching that, obviously very intently, but, hopefully the models change for the better.
And we have employed all of the mitigation techniques here. One of them being, I think did not the governor put out a call that people, when they go outside of their home, if they're going to the grocery store and other places, try to wear masks and gloves. Is that something that you think right now we should all be thinking about?
Yeah, no. So the CDC guidance on masks for the public is that it's optional. They're recommending them, but it's not mandatory. And the recommendation isn't necessarily an N95 mask that you see in hospitals and on the front lines. It can be a surgical mask. It can also be a cloth mask. At the end of the day, you can go to the grocery store with a homemade mask, a cloth mask, a scarf, a bandana, just something to cover, obviously, your mouth and nose, if you so choose. But it is optional. We are not putting any guidance at this standpoint. The state isn't making it mandatory. There are some cities and counties that have the flexibility, if they want to, by executive order or by ordinance in those localities, that if they wanted to do so, they could. Obviously, there's some concern in some of the more fiscally constrained areas in some of our urban centers where people might not have access to masks. We don't want to see people being denied access to grocery stores because, they didn't have a face covering. And so, we want to make sure that we're working through that. We're messaging, we're communicating. And so, look, the CDC recommends it. It's optional, but we'll leave that up to Floridians, whether or not they decide they want to wear a mask when they go out.
I gotta tell you, I think I and my wife, we've been practicing. First off, we were staying at home. I have a pre-existing condition, so I don't want to get involved or get out so that I get next to somebody who might inadvertently, contaminate me. I have MS, and I don't want to be out in public. But when I go out, and I'm going out every evening, around 8:00 when the temperature goes down, to just get a nice physical walk in, so I can do some exercise. But I'm wearing a mask in my elevators, and I'm wearing gloves in my elevators, making sure that when I touch things, I'm touching them with a glove rather than with my bare hands. And, I've noticed that it's kind of strange still that the majority of people out there aren't doing that. And that throws me a little bit, because I think I'd like to see the messaging be stronger to say, look, what, we know that things like this could help mitigate the spread. We all got to participate to be in this together.
I listen. I agree with you. I think the struggle right now is that obviously we all know that there are shortages of PPE all across the country. That's not breaking news. And so I think what CDC and a lot of the states are trying to balance is to make sure that if we tell everybody they must wear gloves and they must wear masks, we don't want all of a sudden gloves and surgical masks to disappear even further, and that to become even more limited, and that we can't get those to the front lines, to our folks in the hospitals, to our doctors, our nurses, our physician assistants, all the maintenance workers, all the people, the real heroes of this, our first responders, our police officers, firefighters, the folks working in nursing homes and ALFs and in home health care. And so I think, if we're just being honest and blunt, I think that's probably the balance, is that, if we tell everybody in the country, go buy a surgical mask, then that will make things even more constricted than they are getting the PPE to the front lines.
So for people like yourself who are out here on the front line trying to keep us all safe, I know you have, 3 small children at home or 2 small children at home?
Yeah, I got 2 kids. I got 2 boys, a 6-year-old and a 3-year-old.
Barely getting a chance to see them, right?
Yeah, I saw them for, 2 minutes when we opened up the Palm Beach testing site, and another 2 minutes when we opened up the Miami testing site, because my family lives in Broward County. I'm up here obviously in Tallahassee in Leon County. It's about 6.5 hours away. So I got to go home for the first time for dinner for the first night of Passover, actually. And so, I saw them for about 4 hours before they went to bed, and then I saw them in the morning, and then obviously I left. But look, that's what I signed up for. I got a lot of people like to give me credit for what I'm doing, but I couldn't do that obviously with my wife holding the house down with the kids. And so I got to thank her for everything she's doing. Having 2 boys is a lot of work by itself. Having two boys at home with no school for the last 5 weeks is a tremendous amount of work. I don't know which one I'd rather be doing, at home with them for 5 weeks or doing this, but I definitely miss them.
And, I mean, we're just listening to the way you're speaking about that. You're speaking pretty much for all the first responders and all those that are out there on the front line, because there are lots of families that are nurses and doctors and people who are out there working every day to keep us safe, who don't get to spend any time with their own family and are afraid to go to their own family because they may have been in contact with somebody who has this illness.
Yeah, look, I mean, I'm not in a hospital, but my wife and I had to talk about that. We talked about, obviously, I've been out and about, obviously being the director of emergency management. I'm around more people during the day than obviously she is. And so we wanted to make sure that, when I came and saw them, that we felt that I wasn't compromising them or vice versa, because obviously we know kids could be asymptomatic. And so, these are decisions that, our doctors and our nurses, our folks that work in hospitals, our police officers, our firefighters, our folks that work in cities and counties, state employees have to make, on an everyday basis. I see the nurses, online struggling with the fact that, they come home to be with their kids and they're worried that they're bringing their work home with them. And by that, I mean potentially COVID-19. And so, look, that's why we've tried to expand rapid testing dramatically in the state. We've helped. The governor's been talking to the White House about, getting those Abbott laboratory tests here. We had 10 hospitals that got those tests originally. We got 20 more of those machines that were just recently delivered to us that we're getting out to more hospitals and to community centers to do testing in specific areas, because that really is a game changer if we can get more and more of those, because you can find out if you're positive or negative in somewhere between 5 and 15 minutes. And so, the days of having to wait, 5 or 6 days for results, we're hoping in the coming weeks that, there'll be more and more of these rapid tests available, because that really is what will give that nurse or that doctor, that first responder, that hero on the front line, that's what will give them that comfort that before they walk in their door and they're with their loved one and their kids, that they're not bringing anything home with them.
And, when you talk about the rapid testing, that requires some additional materials and additional, supplies to be able to even conduct these tests. Talk a little bit about the difficulty you've had with being the head of the response for the state of Florida of getting the proper amount of equipment, meaning everything from PPE to even the swabs for these tests.
Yeah, I mean, listen, I've been well on the record on that, and so I'll dialogue a little bit of the journey. And this is not just what's going on in Florida. I talked to my counterparts in California, New York, other states. It's the same in every single solitary state around the country, and that is that at the end of the day, the demand exceeded the supply. That's obviously obvious. A lot of this stuff is made in China. It's made not in this country. And so when other countries like China specifically got the virus first, all of that supply went to handle that. And there wasn't a lot coming out of the manufacturing plants. And then, of course, you get countries that start playing games, not wanting to release this life-saving PPE back into this country. And then we even complicated further that with the stuff that is in this country, you had, distributors, vendors, brokers selling that stuff to the highest bidder, to foreign governments, shipping it, exporting it out of the country.
Prices up?
Oh, no question about that. I mean, these N95 masks are like $1. Okay, they're usually like $1. These surgical masks are usually like 60 cents, 75 cents. I mean, I've gotten deals pitched to me as much as $10 on N95 masks. Now the market seems to be somewhere in the $5 to $6 range. But it's the wild, wild west of medical sales. Obviously, I wanted to raise the alarm bells. I was talking to my folks internally, realizing that we were running a boiler room for PPE, something out of the Wolf of Wall Street. And I said, we got to talk about this publicly, because it can't just be us. And it wasn't. And then obviously we saw, the White House step in a couple of days later, use the Production Act on 3M, them then come to the table and strike a deal, which really is all that matters. I mean, and that, if they're going to bring in 55 million masks a month from Asia, some of that is already starting to come in, and we're stopping exports. Listen, we want to make sure that we're trying to take care of the world the United States plays an integral role in doing so. It helps, obviously, decrease famine and disease in other countries, which, when those things rise, become our problem anyway. But in this instance, right, we got to make sure that we're taking care of our folks in our hospitals, and we're not doing things or allowing companies to do things around the world to help their bottom line rather than helping folks here first. And so, look, very early on in January and February, when we weren't dealing with COVID-19 like we are now, we did help the world. And that was the right thing to do. And so, but I'm happy that, we've stopped that practice at the moment, put a temporary pause on it to make sure that these extremely important medical supplies stay in country, and that we're able to bring in these materials from other countries. I got to tell you, Montel, I think there's going to be a sea change going forward in manufacturing. Whether or not the federal government takes a role in that by helping these corporations bring manufacturing back to this country. But I really do believe we have been exposed to a major national security issue. It's okay, I think, if your kids' toys that you buy at Target or Walmart are made in China. But I do think now, ventilators, prescription drugs. The fact that 90% of ingredients for prescription drugs are not made in this country, I got to tell you, I think we need to figure out a better balance so that we can be more self-sustainable in the event we wind up with something like this in the future.
Do you think, though, that message right there is getting through to some of our other politicians who are decision makers? Because it seems like to me that some of them are just, yeah, okay, I hear you, and just paying lip service. And then 6 months from now, let's say that all of this kind of rears its ugly head and it slows down. And 6 months now, we go back to business as usual. But screw it, we don't need to develop the factories here in the United States to provide us with the ingredients or the parts for other things.
Well, no, look, you bring up a good point, right? I mean, we turn the page on news stories here faster than any other country. There's no question about that. And so, right now, this is the hot topic. In 6 or 8 months, will we be talking about that? But, the Florida delegation, Democrats and Republicans, have really been working together to make sure that they're doing everything they can to make sure that the Division of Emergency Management and our residents, get what we can, get our fair share so that we can get it to the front lines. But I talked to, putting my old hat on for a second, I talked to a lot of Democrats, I talked to a lot of Republicans, and while they come at it maybe from different positions, I think that there is a dramatic consensus that this is now a national security issue, and that we can't depend on the world to manufacture things for us if they need those things themselves. The line I've been telling everybody is that, look, usually in a hurricane, we're competing against a couple of states, the federal government buying resources. And now we're not just competing against the whole country. We're competing against everybody but Antarctica. And so, when that's going on, at the end of the day, you got to be able to focus on what you can produce in country. And the fact that we have, I think, to a further degree than everybody realized, maybe even myself, that there are just some life-saving medical equipment, medical supplies, medication that we are now, we have outsourced that. U.S. companies have outsourced that, manufacturing them in other countries. That's something that's got to be examined. And it's not something that we need a dramatic shift on. Let's be clear. We're very good at this country of we do one thing one day, and then all of a sudden, we go to the opposite corner the other day and we have an overreaction. We don't need to overreact. We just need to have a plan going forward that we're able to make sure that we can meet the needs of our citizens without having to depend on other countries in the event, they have issues of their own. And so I just think it'll take a good coordinated strategy with U.S. companies at the table, federal government there as well, to make sure that we can make this stuff in our country again.
I hope that, because, when you take a look at when this comes not to an end, but when this slows down, the prices of things like, the N95 mask will go back down. There'll be those that don't think that that's, financially solid enough for them to want to start businesses to continue to build masks or make masks when the problem doesn't exist as prevalently, right?
Yeah, listen. No, there's no question about that, but that's why I think the federal government has a role to play. Listen, without without getting too deep, right? There's positive and negatives to capitalism. But if we want corporations, obviously, to bring their factories back to this country, which will be an amazing jobs program, as we try to turn the page on COVID-19, we don't yet know where the economy is going to be. I mean, this could be an amazing jobs program where this life-saving stuff is going to be made here. And it's not just for COVID-19. We now need to think beyond that. What else is there that fits into, the life, health, safety category that, we're making a dramatic percentage overseas. And so we got to look at that. I mean, having your iPhone not made here isn't a life or death scenario, but ventilators can be, right? And so I think there just needs to be a comprehensive conversation, and we need to look at stuff from a national security interest. It isn't about bashing other countries. It's not about superiority. It's just about making sure that we can take care of our own.
I don't have a crystal ball, and neither do you, but I've had some conversations in the last couple of days with some friends of mine who said, that we are literally only one day away from this turning into a cataclysm, in the sense that if over the next couple of days, right now, I think most of the scientists, most of the doctors are saying that, with warm weather, most of the time viruses like this will dissipate some. But they're looking at this virus and saying, this is a little strange. It may not dissipate with the warmer weather. This could mutate, and mutate in a way that all the tests that we have right now become invalid. I mean, if you were to have to crystal ball this, are we at the same time dealing with this problem that we have right now, trying to anticipate what could be the next problem right on the horizon?
No, Montel, it's a great point. I mean, that's why all of those things that we've put in place weeks ago, even as the data started to get better, we've not changed our position. We've stayed the course, steady as she goes. And so, we're going to bring on 900 hospital beds in Miami-Dade County, 450 of those in the convention center, 50 of those being ICU beds. We're bringing on the Pan American Hospital back online, 200 beds there, and then we got a 250 bed field hospital. All of these are acute facilities in Miami-Dade. And then I have 4 other facilities that are 250 beds each, one in Lee County, one in Palm Beach County, one in Broward County that's online, ready to go, and then one in Jacksonville. And so if we had to bring up those facilities, we could. Then we have mobile units that we've procured, 15-bed ICU mobile units that you bring in via an 18-wheeler that we could drop in a rural community. And so we've not pulled back on any of our plans that we put into motion a month ago, even as the data gets better, just because of that circumstance you described. I mean, the thing that I'm planning for now is, Montel, I mean, I hate to bring it up, but I'm planning for hurricane season. And I'm planning for hurricane season with COVID-19. And so
they're talking about this could be one of the more severe hurricane seasons of the last 5 to 6 years.
Yeah.
Right?
So right now yes, sir. So right now the early predictions are somewhere between 14 and 18 named storms, very similar actually to last year, in which we, dodged the bullet of Hurricane Dorian, which would have been, make no doubt about it, the most devastating hurricane ever hit the state of Florida. And we'd still probably be doing cleanup from Hurricane Dorian now in certain areas while we were dealing with COVID-19. So thank goodness that did not happen. And so, here are the questions, Montel, that we're planning around. And we have a planning cell right now that we took out of the EOC that is working specifically on these topics. Do we use schools as shelters if there's still COVID-19 prevalent? How do we check people when they're coming into shelters? Do we have a rapid test to do so? Do we take their temperatures? If somebody does come to a shelter and they're positive for COVID-19, do I turn them away? Do I send them back, basically on their own? Or do I bring them to a specific COVID-19 shelter? How do I do evacuations? Do I evacuate from a hot zone? Do I evacuate into a hot zone? And so all of these are things that we're looking at and drawing up plans and procedures, for that July, August, September, October timeframe, when we know we're entering, the heart of hurricane season. I tell people that, look, obviously there's a bigger chance when you have more storms, but Hurricane Andrew hit in one of the slowest years ever on record. And so it only takes one storm to bring a disaster. And so, we have to be thinking about that here in Florida.
That one storm could be that turn to the left or the right. You just mentioned September, October. September, October, back to school. What are you thinking about right now? I know you're trying to plan this out. And again, it's fluid. Every day it changes. So let's say we hit our peak here in Florida, April 21st. We have 4 months before we have to start thinking about getting kids back in the classrooms. And then the weather starts to change and it gets cooler. And so we could have another spike of this. I mean, if you had the crystal ball, or not crystal ball, but maybe just think ahead, what are you thinking about the next 5 months in Florida will look like?
Yeah, listen, obviously that definitely seems to be the conversation du jour at the moment, as far as, when can schools reopen? When can we get back to some semblance of life? And will there be a second wave of this in the fall? And the truth is, Montel, while the policymakers are having those discussions, and I've weighed in with my opinion of the moment, I mean, I'm still really laser focused on the peak of this on April 21st, and then making sure that we have hospital capacity, thereafter ventilator capacity, ICU capacity. As I said, deaths are going to lag, and so we're going to have a lot of families in the state of Florida. Losing family members, it's going to be very tough for them. They're not going to be able to go to their funerals. They're not going to be able to, go see them in the hospital. And so it's, we got to get through that part before I can start wrapping my brain around is, how do we, what is my guidance, on bringing stuff back online? How can we do that safely? Working with the Department of Health and the governor, obviously, on making those decisions. So, I think obviously those are conversations to start having in May on what those plans would be like. I just think right now that's all very premature.
How are you dealing with right now? Looking across the country, we're starting to see, this chasm between the haves, the have-nots, the underserved communities, the minority communities, people of color, who seem to be, more prone to the more adverse effect of this virus. How are you trying to right now deal with that in the middle of building a hospital and the convention center? I've had some people reach out to me from Europe recently talking about an idea of even reaching out to airports. I mean, we look at the airport right now is probably at about 80% capacity. So there are terminals in that airport that you could shift planes over to separate terminals and utilize an entire terminal if we needed to for space for a hospital. But, the numbers in the disenfranchised communities seem to be growing. What are you doing specifically to address that?
Well, I think the first thing is we got to be honest about the situation, which I think is extremely important, right? In the state of, we're seeing those numbers nationally. Now, in the state of Florida, right now, thankfully, the data doesn't show that disparity. Right now, we're seeing it among in African Americans and the Black community. About 18% of our deaths are in the Black community, and so that with
the population, pretty much
correct. So that corresponds very close to the population here in Florida. Obviously, some states are seeing that number in the 30% and higher. Now, that doesn't mean we can't trend that way. It just means as of today, we're not there. So, we had a call yesterday with the Black Caucus here in the state of Florida, all the representatives, all the senators, and obviously this was a hot topic, and we get it. We also get, obviously, that, in certain communities of color, right, there are underlying illnesses that make them more susceptible to COVID-19. And those are long systemic reasons of why those things exist. There should also be no surprise to people out there that obviously folks that come from a different socioeconomic background and have different access to health care. Not that the test of COVID-19 isn't free or that the health care to COVID-19 isn't free, but that the fact that they've not been getting good health care for years and years and years, which may have exacerbated, obviously, these underlying health conditions, now makes them more susceptible to COVID-19. And so we are trying to expand testing in more of our urban settings, in our communities of color. Obviously, we have, the Hispanic community in Dade County. You have the Haitian community in Dade County. You have the Caribbean community in Broward County. And so, making sure that we're working with community leaders in those areas who are on the ground. We have drive-through testing. It's very possible that, in some communities, drive-through testing doesn't work. So we have to come up with other ways to do that. We're talking right now.
You got to convince some of those leaders in those communities, like especially the last 43 which we'll system off, to get some of the social influencers to stop this crazy messaging that somehow says people of color are more immune to this disease. This is really absolutely insane, I think.
Yeah, no, I mean, that's obviously not true. I know those social influencers that you're talking about, and so look, I think all of those deniers, all of those conspiracy theorists early on, I think all of that now has been completely disproven, and so I don't spend a lot of my time on that. What I do try to spend my time on is trying to help those people on the ground operationally. And so, I do think you're going to see the state of Florida, again, even though the data doesn't support it, we want to get ahead of that potential issue. We want to make sure that folks have access to testing. We have, like I said, a lot of multi-generational living situations. We have, obviously, parents taking care of grandparents in the same home. We have, grandkids that, are their caretaker. And have to see them on an everyday basis to make sure that they get food and their medication. And so, we are trying to come up with programs to also make sure that we have a representative sample in our testing data, so that as we have these numbers, that it makes sense because that we have a representative sample. And so, in the healthcare and in the testing, that's extremely important. The other phase to that, Montel, obviously, is that as unemployment numbers tick up, there's going to be a tremendous amount of strain on our federal programs, such as, the free and reduced lunch program, the WIC program, the SNAP program, all of these feeding programs. Feeding Florida, right now is seeing a 30% increase on the amount of people they have to feed. You're seeing these lines miles long for people coming to pick up food. So that's something that here at the division we're extremely concerned about, and we're working on, executing on plans that we've had in place, quite frankly, from our hurricane planning, to make sure that we do what we can as, again, a lagging effect of this. After the amount of cases from COVID-19 goes down, we could still see unemployment tick up and up and up. And so, making sure that those checks get to those families to try to help them get by is extremely important. But even beyond that, making sure the Division of Emergency Management steps up and fills some gaps where they exist, making sure people don't go hungry.
Are you finding it as tough to be able to get things like food supplies as you have found it being tough to get PPE? I know somebody described you as kind of like the James Bond right now, as you go around the world, literally physically trying to argue and battle and bid for protective equipment. But are we having the same issues when it comes to getting food and supplies for those who are in need?
No, thankfully we're not. And thankfully, between in this state, the Publixes and the Walmarts and the Cheney Brothers and the Ciscos, right now we're seeing the food supply chain holding pretty well. I mean, obviously everyone knows the run on toilet paper and paper towels, and one day we'll have to figure out how that happened and why. But right now we're not seeing any supply chain issues in food. Now, as potentially the numbers of the amount of people that may need food assistance increases, we're going to have to expand our ability to bring that food in. And so one of the things I know people are talking about is reaching out to the small business restaurants and the large restaurants and bringing them back online in a coordinated way, potentially to help feed. We have massive commercial catering kitchens here in this state that could help do so as well. And so this is an all options strategy on the table, because obviously, we want to make sure we feed people and we put people back to work potentially in the same way. And so, look, that's going to be a lagging effect of all of this. It's going to track with unemployment. And so obviously, depending upon how long these mitigation measures have to go on to keep people safe and how long the economy has to be closed, that could be a real coming, major effect of this. And the governor has talked about that. The governor has specifically talked about, what happens when you close the economy, all the effects that come afterwards. So we have to be prepared for that.
Look, Jared, I can't say thank you enough for being a participant today on Let's Be Blunt with Montel and being as blunt as you've been, because I think people really need to hear this straight from the horse's mouth. And thank you so much for being here with us. Any last messages you want to share with our viewers, and when it comes to what they should be doing right now? I mean, you heard from the president's press conference. He wants to try to get the economy up and going again by May 1st. Yet we may not see the peak in Florida until April 21st. That would only give you 9 days to get us back up and running. So that's not going to happen. So what would you say to the Floridians that are tuning in right now and what they should be anticipating?
Yeah, I mean, what I would just tell people, frankly, is they got to stay the course. They got to continue social distancing. They got to continue the mitigation measures. I don't want people to get a false sense of security just because we see the curve flattening. And what I would say to people is think about the hurricane mentality, right? The hurricane is barreling towards us, and now we've seen a slight jog away. But it's just a slight jog away from us. And so we got to continue to see if that jog continues away before we're out of harm's way. And we won't know that until we get through, the middle of next week and the end of next week to see if that hurricane coming towards us, if it does continue that turn away. And so I think right now we got to be vigilant. We got to stay the course. We got to continue our preparations. We got to continue to social distance. Folks going to, for having Easter on Sunday, we got to make sure, obviously, that, as we declare religious activity an essential service, because we want to make sure that people have that ability to pray, especially in these times, that we don't have mass gatherings, that the CDC guidelines are still followed. And so that's what I would tell people. We're not out of this yet. We're going to have some, a lot of bad news next week as the deaths, lag the hospitalizations. And so that's what I just want people to focus on. And Montel, I want to thank you for, all the issues you're always advocating for. I know you got a very active Twitter, and I see you always advocating on behalf of a lot of people. So I appreciate that.
And thank you so much for what you do, sir. Please, God bless you and your family. I hope you get a chance to see your sons again real soon. And take care of yourself. We need you.
Thanks, Montel. Appreciate that.
Thank you. Yes, sir.